Okay, I think you guys can go.
Okay.
All right, so I will kick us off and want to welcome everyone who's watching the Facebook Live today to thank you all and joining us. We're all going to be talking about coming out, and then I will also have everyone introduce themselves and where we come from, and hopefully we'll learn more. So I will start us off. My name is Stephanie Castrejon. I am a supervisor for the Outreach and Enrollment Team at Heartland Health Centers, and I use she, her pronouns, and I will pass it off to Faith.
Hey everybody, my name's Faith Knocke. I use they, them pronouns, and I'm a program assistant at Lurie Children's Hospital for our community programs and initiatives team.
Yeah. Hi everyone. My name is Logan. I use he, him, his pronouns, and I'm a program coordinator within the same division as Faith. And yeah, last but not least, Michelle.
Thank you. My name is Michelle Phan. I'm a general pediatrician at Heartland Health Centers at the Uptown or Wilson location. And I'm excited for the conversation tonight.
All right, so I guess I will kick us off with the first question. What does it look like to come out?
I think that probably, it looks so different for everybody. Generally it's testing it out, trying it out, somebody that's safe, that you trust, that you can talk to, seeing how it goes, and then it kind of expands from there.
Yeah, for sure. I think, Faith said it where it does look different for everyone, and depending on where you're at in the world and what your community looks like or lack thereof, unfortunately, for a lot of folks, sometimes coming out can just look like a Facebook post, or could be, a online family and friends that you've created, and that's who you come out to. Or it could mean, so many different things, family, friends, coming out in your high school, college. Yeah,
definitely. I told Twitter before I told my family.
The first time I came out, there was lots. Also, this to say, it's like there's never this one time that you come out. It's like over and over and over again. But one of the first times I came out was to a school counselor, and I said, you know how some people like broccoli and some people just don't? We don't judge that person for liking broccoli or not liking broccoli. So that was how I came out, in a very roundabout, twisted way.
Yeah, I definitely agree. I feel also that for myself, just like you said, it's like coming out in just not that one time, but there's so many multiple, and it's like your friends, your closest friends, your friends from this community or this organization, and then your family members. So I feel like it's a constant, I say journey. And it's, I don't know, it's always different. The experiences that you'll have with whomever you're talking to is also different. The reactions are going to be different. So yeah, I completely agree that it's, it's different all around, but yeah.
I think that idea of like your online community or your chosen kind of safer like layers of coming out. As a pediatrician, I think that'll be a takeaway for me, and be like, hey, maybe take the small step, or like where you feel most comfortable, even if that's online. It doesn't have to be like what we see like in movies all the time, where it's this big conversation in front of everybody.
Coming out at the prom. Or something.
Yeah. That's actually a good point too. That's something we talk about with youth a lot, who might come to us or like go to a teacher and be like, I want to come out to everybody, but I just don't even know what to do. You can start with a safety plan, like who's the safest person you can talk to first? Who's the next person? Yeah.
Definitely. Which I think would be perfect for me then to go on to our next question and talk about how can youth who are coming out discuss with their school or family or friends in a safe way?
I'll start. I think, generally youth you know, they experience their own experiences, and so they know like who the safest people to be around are. So I'd say, you know, first and foremost, helping you identify those people and not, you know, necessarily pushing them to tell their family if they don't think it's if they feel it's unsafe, you know. But
yeah, I feel like that's the thing too. You know, even if we know who the parents are, if they're people in our community or in our school system, and we're like, oh, Mrs. Smith, of course she'll be fine with this. It's like, we don't know what happens at home. We don't know how this like person's going to react. We don't know their history with any of this or lack thereof. And so when someone comes out, you know, we want to affirm them. We want to take what they're saying seriously, and just listen. And I think what's super important is to ask, hey, what do you need? Because that's going to be different for every single person. When we have kiddos come out, some kiddos are like, or teens or youth or however they identify, when they come out, you know, some people are like, hey, I'm gay. And they're like, that's all. And they're going to walk away and they don't want to talk about it, you know? And then we have the other side of the spectrum where you're the first person that they're going to tell, and they really don't know what to do with this information and they don't know where to go. And so, you know, just saying, what do you need? Who knows? Who do you want to know? Yeah, and I think those are just three super important questions.
Yeah, and I think in terms of the school space, you know, if a youth wants to come out at school, just knowing that you don't have to come out to the entire school all at once. You know, you can talk to one teacher, you can try to, you know, put together a support plan, work with your counselors, your social workers, find your best friends, you know, like make a support group that's going to be there for you.
Yeah, look to your GSA for tips as well, or the wonderful teachers that support the GSAs. Those automatically are you know, people that are like, hey, I'm here, let's hold space, you know? And also, you know, being an adult, and if a youth comes to you and they come out, it's like, okay, be the adult in that moment and say like, how can I help you navigate this? Like, would you like, you know, if a kiddo comes out as transgender, like, would you like me to start using an affirming name? Do you want to keep that between us? You know, there's all of these different questions because there's going to be all these different answers between, you know, person to person.
Yeah, definitely.
Yeah, I think that's helpful to know, because I think, how can we be helpful and not make it about ourselves when someone comes out, and centering this person who's very vulnerable and supporting them.
Yeah, because that's the other piece too, is we don't want to assume that somebody coming out like needs to go see a counselor.
No.
Or, like, you know, like they might just be like Logan said, hey, I'm gay, and then they're like, that's it, I just wanted to say it out loud. And you're like, great,
okay, whatever you need.
Right. Yeah, and I think it's important too, you know, even, and I'm jumping ahead in questions, but like when we're speaking to teachers, when we're speaking to medical providers, when we're speaking to, you know, our people in our community, I think transparency is huge. Where if you don't know something, let's not pretend like we do. And if we're not sure how to support this youth, let's say, you know, hey, I don't have all the answers right now. Thank you for trusting me. Thank you for telling me. What I'm going to do is I'm going to do the research. I'm not going to ask you. I'm not going to put it on you. I'm going to go home and I'm going to do the research. So when we talk again, I have more answers for you.
Yeah, definitely. I think, everything that you share with us is very helpful, and it's something to take into consideration and always keep in mind. Because I feel like you said, everyone is different and everyone will react in a different way. And it's only, I guess, if you're on the other side, to just, you know, be the person to listen and to be there. So yeah, I think that's definitely important. And I think for the next question that would help lead us to this is, then how can we support youth who are coming out to when it comes to family members? And again, every household can be different. We know that culture and religion can play a significant role. So how can we help?
Yeah, I think, you know, Faith said it in the beginning, where it's come out when it feels safe. I think that's huge. You know, coming up with a safety plan is huge, especially if for cultural reasons or religious reasons, you don't think that it's going to go over well, or it could compromise where you're living or your safety in that regard. You know, that's also something, it's like, we don't want to push people to come out. People are going to come out when they're ready. And, you know, once again, we don't know what their life is like at home. We don't know what that safety looks like. And so I think, you know, that's definitely something you have to really put in the forefront of your mind is, you know, am I safe to do this right now?
Yeah. I think the other piece too would be, you know, always supporting people. Like, they're like, I want to go talk to my family, or so on, but I lost my train of thought.
That's totally fine.
In like coming up with that safety plan, like what are things that you would help someone think through?
Yeah, so if you are, I mean, for me, like when I was coming out, I was just like, I can't hold this in any longer, you know, and there was, and there was like, yeah, having this bottled up and needing it to come out, where I'm like, I don't even care if this doesn't go over well. I'm not even in that headspace, or like, I'm not even thinking about that. And so, you know, if you can be that adult in someone's life, or someone who has gone through this experience, just like talking through those scenarios is going to be really big. As well as like, hey, do you have a friend you can stay with if this doesn't go over well? Do you, you know, do you have a way to get to school if this doesn't go well? Different things that we need to think through. You know, what do they say? Hindsight's 20/20. Like, I can look back and now I have all these great resources, whereas before I'm like, I don't care, and I'm doing it now.
Yeah.
I was going to say the other piece to that too, in supporting youth who are coming out to their families, is that at the end of the day, you know, as much as we can, we want to help like change people's minds and stuff, but you can't always, you know, like there's someone who's not going to change their mind, but you can be that one supportive adult, or that one person like in their life who's like looking out for them. And I think that's the biggest thing you can do, is just being like, I'm going to be here no matter what. This is it.
Yeah, and I know that, you know, we talk about this statistic a lot, but 2019 Trevor Project took a statistic that says having one supportive adult in an LGBTQ youth's life decreases the chance or the attempt at suicide by 40%. Wow. And that's one adult. Yeah. And not a parent, not a guardian, but just one supportive adult in their life. So that could be their doctor. That could be, you know, the school counselor. That could be the coach, you know, for the soccer team.
Yeah, I think sometimes we feel like this responsibility to like, I'm going to fix your home. Like, you can't, as long as you're there. And I think that takes the pressure off of everybody. And we can just be like nice humans together in this moment.
Yeah,
absolutely. And I think too, like modeling behavior, if you do have an opportunity to interact with the parents and, you know, to speak vocally about your support, or, you know, if it is a doctor's office and you have like pride stickers or pamphlets with non-traditional families, you know, instead of always having mom and dad on a pamphlet, you have mom and mom, or grandma and grandpa, you know, just different things like that. So it's not that we're preaching at people all the time, but we're showing it in the way that we live our lives.
Yes, definitely. And I think that would be a great segue then to the next question, which is, what can medical providers do to create a safe space for patients who are queer or coming out?
Yeah, I think definitely asking people what they need. So, you know, because medical records sometimes, you know, can be seen by their parents and things like that, really getting the details of like what's going to make them safe and comfy. Like Logan was saying, like, do you want me to use this name with you? Do you want me to use this name around your parents? Do you know, do they know? Do you ever want them to know? Those sorts of things are always super helpful.
Yeah, and also having a discussion around like, you know, if we use a different name that feels affirming, that feels good to you when we're alone, and then we use a different name when we're around your parents, what would happen if I messed up and I accidentally said the wrong name? Let's talk about that scenario. You know, just because, you know, let's talk about them all. Let's knock on wood, it doesn't happen, but mistakes happen. And then I think too, once again, just like transparency, like I said, if you don't know an answer, let's not pretend like we do. let's say, you know, that's really great. I'm going to do some research. I'm going to ask a colleague and I'm going to get back to you.
Yeah.
Definitely. I mean, because that happens to me all the time too. You know, like I'll work with other gender non-conforming youth and they'll ask me a question and I'm like, you know what? I actually don't.
Where do you go then to get the answers? Like, what are some of your favorite resources in the medical space, I guess?
In the medical space, I'm like, hello, doctor, you know. But for us, I mean, there are a lot of, we are very fortunate enough to get to teach sexual health education within our division too. So we get to go in as a third party to a bunch of different school districts. And so some websites that we really lean on as just really wonderful, progressive, affirming resources are like Scarletine. Scarletine is a great website. It's like with teens who get to ask questions. Amaze.org is a really great resource for younger kiddos that has these like, you know, animated videos that help you understand. Sometimes I'll even send it to our parents or when we go and teach like adults, because I'm just like, they break it down in a way that like helps you get it. You know, yeah. Cool. I
think the other thing I know is that if people ever want to take, you know, a real big deep dive, we do offer gender equity trainings and LGBTQ 101s. So if you want to really dive into all the research.
Yeah. Awesome. I'll definitely check out those websites. But I think your tips of like troubleshooting and asking all those scenarios is so helpful, because we have this like special time alone as pediatricians where it's like your parents out of the room, let's talk, like real talk, and how to make use of that time together.
Yeah, absolutely. And I think too, like letting the preteens and the teens know, because I know in the state of Illinois, 12 and up, that's when you can have that private time with a medical provider. And so we tell our teens, like, ask your doctor if this is going to be kept confidential between the two of you. Mm-hmm. And you know, if you are someone that needs birth control or an STI test, ask if that's going to show up on the insurance bill to your parents. If that's not something you want them to see. And so I wish I had this information when I was a teen and you know, these services.
Yeah, I think empowering teens and youth to remind us, like, sometimes people have the best of intentions but forget, like, have their workflows and print something. Mm-hmm. So yeah, empowering people to ask those questions, remind their medical provider, and as a medical provider, recognizing like we mess up, we're learning.
Because we're all humans, you know, and so we're never going to have all the answers, and we're all going to make mistakes from time to time. So
mm-hmm. I think a big way to avoid some mistakes too is, I always say, like, just never make assumptions. You know, don't make assumptions that somebody's gay. Don't make assumptions that somebody's straight, transgender, not transgender. You know, and that's very helpful. If you go in with an open mind, it makes the patient feel a lot more open and like welcome to talk about who they are when they haven't been pigeonholed into like a box.
Right. Yeah. And then, you know, once again, for providers too, it's like having that signage in your office, having pamphlets, having those charts that people can see, to be like, okay, this place affirms me, they see me, I'm accepted here, you know. I think makes all the difference. Like, even when I see that at my dentist, I'm like, oh, cool. I feel better about this. But I feel better, you know.
Yeah, and I feel like definitely, as we've all mentioned, like, it's very important nowadays to continue empowering like the youth, because I feel like this generation is just so, I feel like they've just grown and they really take advantage of social media. So yeah, and I think, you know, keeping them to feel empowered and to feel like independent is good.
Yeah, it's a partnership. It's not like,
for sure,
I'm telling you what to do. Like, I think hopefully that medical relationship has shifted by now. But also as a plug, because you mentioned like STI testing and everything, we can definitely not show that to your parents or have that show up on your like visit summaries. But we also have a program at Uptown, the Title 10 program. So if you're uninsured, or if you don't want you're under your parents' insurance and somehow you're worried about that, we can put you on a different program for any like reproductive health visits or services where you might not have to pay, or it won't show up on your parents' insurance.
Yeah. I mean, and that is so powerful to have that knowledge, to know that like I can go here privately, or I can go here and not have to worry about the cost of something. And I will say too, when it comes to like really anywhere you go, but like a doctor's office especially, or a medical provider, when you're filling out that form too, what we always say is we love more lines than boxes. So if there is a line where I can put what my affirmed name is, the name I want you to call me, and then a couple lines down, that's my legal name. So like when the doctor, you know, doctors are busy, nurses are busy. When you look at that chart and you see the first name at the top, you're going to call me what I want to be called. And then when someone needs to, you know, do the notes or chart what's going on, they can see that my legal name is lower. And it's just like little tips and tricks like that to, you know, make that experience that much more safe.
Yeah, definitely. Yeah. So, and then my next question is, what are common institutional barriers queer folks face?
Just generally, or in the medical space?
Let's do medical space.
All right. I'd say when you were talking about reproductive care, the thing that came to mind is like learning about trans bodies and learning about birth control for trans folks and other things like that. Because like I was saying, don't make an assumption is like, sometimes people make an assumption like, oh, this is, you know, a cis man in front of me, and don't think about giving them birth control or something. Like, actually, this person has a uterus and should be, you know, learning about these things.
Yeah, and I would say within that same breath, I think like LGBTQ healthcare often gets lumped together into one thing, but the needs of a cisgender, you know, man who has sex with men is going to be very different than a like, you know, a cis woman who has sex with women, or, you know, any other folks of different identities and different, you know, just like sexual activities and preferences. As we see, like a lot, you know, people that identify as lesbians or cisgender lesbians are some of the lowest like rate of folks that get like cervical care or pap smears or you know, any of those things, because, you know, maybe they're not having the type of intimacy that one would assume you need for a pap smear. And so, you know, the rates of cancer go undetected in the population of people because we're not checking for that regularly. And so that health need is going to be very different than, you know, someone else in the LGBTQ that identifies differently.
Yeah. Okay. I'd also add that while people do make mistakes and things happen, if you've harmed somebody, the harm's done, and they're gonna tell everybody else about it too. You know, so we talk about that in schools too. Like if a teacher is, you know, not being supportive or misgendering folks, that it's not that that classroom just feels unsafe. Now the whole school feels unsafe. And so that's a huge barrier, is that LGBTQ folks are just not accessing healthcare because they don't think they're going to get the right healthcare. They don't think they're going to be treated well. So just trying to do everything you can to make your space welcoming and affirming.
Yeah, and don't ask the unneeded questions. We always say that too. If I go into, you know, I have a sore throat, why do you need to know what's in my pants? Yeah. It doesn't matter. I came in for a sore throat. And so we always say, yeah, if it doesn't matter with what we're getting treated for right now, then let's leave that off the table. I also know too, like when you go to doctor's visits, let's focus on one thing at a time, you know? So,
yeah. Great.
That is a good tip. Yeah. I think definitely those are such good helpful tips. Like, do no harm first thing in medicine. Like, if you don't know, don't say more, don't put your foot, like, say something that could be harmful or wrong, and find out first, or if it's not related, just be there.
We did get a question from an audience member, and they're asking, what barriers did you face from straight folks when coming out, or what are common barriers?
Yeah, I mean, I think it all depends on where you're at when you, like, geographically, you know, when you come out, and the communities that you're, you know, either involved in or kind of forced to be in, you know, when you're a teen and you can't choose where you live and you can't choose where you go to school. And so, I mean, for me, I think there's a lot of curiosities with people that have minimal understanding of, you know, people in the LGBTQ community. And so you get a lot of these really inappropriate questions, you know, and that even just questions will keep me out of spaces that I would regularly like to occupy.
Yeah, definitely. I think too, exactly what you're saying about like location, like as personal experience, my biggest barrier was that I grew up in rural Missouri. And so like, I was one of few, like, and, or at least who were being open about it. And it didn't happen until after high school that I was like comfortable to come out. So that whole thing was a barrier, you know?
Yeah, and I mean, that's super different from my experience because I grew up in Chicago. And so, you know, although it was not as affirming or accepting, you know, 10, 15 years ago, I still had wonderful resources throughout the city or larger communities of folks that were open with identifying as outside of like straight and cis. So yeah, I would just wholeheartedly agree with what Nate said.
Great, yeah, thank you. And then I have another question that I think would be also a perfect way to continue talking is, how can folks then who are coming out protect their emotional health? What are some feelings or experiences they should be prepared for?
If you know how to protect your emotional health, please let me know.
But I think definitely like have a buddy, you know, I mean, just for any situation that you're going through, if it's going to be something tough, like we've been saying that around like kids returning to school in COVID, it's like find a buddy who understands that this is hard and not fun, or, you know, that this is like, can be a harmful experience depending on where you're at, it can, you know, and so creating a support group as much as you can, even if it's just one person.
Yeah, and I know nowadays too, like with all of these platforms, like even within our division, we do virtual groups for teens and kiddos. And, you know, if you don't have a buddy, come to our virtual group. You'll meet a buddy, and you'll know that they're an actual teen, and you know, they are who they say they are.
It's a safe group.
Yeah, it's a safe space, you know? So, but yeah, just having that support system can be totally different, can change your whole mental health attitude on coming out and what's going on, especially if there are folks in your life that are not affirming and not accepting. To just have that person to lean on, or to be able to lean on each other, just makes all the difference. I would say too that, like, do what you need to do to be able to survive. And I know that's kind of broad, but like I said, if you're a teen and you don't have control over the money you use, you don't have control over where you live or going to school or what you eat, or even what you wear, you know it sucks right now. And I kind of hate when people say it gets better, because when I was a teen, I was like, but I need it to be better now.
Yeah.
Just looking out for yourself to get through, and having, you know, internet friends, friend at school, staying after for a club. Like if it means staying out of the house, that was something that I did, you know, when I wasn't feeling accepted. I joined clubs. I joined all the free clubs I could just to get out of the house.
Yeah.
And I think checking in with yourself before coming out, just kind of making sure you're in a good place. It's just kind of like feeling neutral and whatever. and to think through different scenarios too, like worst case scenario, what could happen? How would you react if that happened?
Also, in the state of Illinois, I know that you get, I think, at least 5 to 8 90-minute sessions with the school counselor. So that's free. You know, you don't have to go through insurance. Your parents don't have to know. If anything, the school counselor's not supposed to tell your parents if you're above the age of 12. And so having those sessions to kind of talk through the scenarios with someone who's in your community can make all the difference as well.
Yeah, definitely. And yeah, and I feel like us oftentimes as well, some youth or, you know, those who are becoming of age, like 12 and up, don't really recognize or know that this exists. Like, hey, you do have the opportunity and chance. So it's really reassuring that you're sharing this information with us, and now we're sharing it out there. So I think, again, it'll hopefully empower our youth, and I think it's very important. Because I also agree with you guys. Like, I wish I had, when I was at that age, I was like, I wish I had the mental capacity to be like, hey, check in with yourself, or I had this, because I'm like, nah, you know, I'm just gonna go for it. And then I was like a wreck. And yeah, it's always good to give yourself that time and space to be like, okay, take a moment, where am I at? And then, am I ready? And then, yeah. Great. And so my next question then is, what are resources for people who are thinking of coming out?
Yeah. So those websites that we gave previously are wonderful resources. Scarletine, like I mentioned before, that's going to be questions from teens answered by teens or young adults. It's also going to have a lot of resources on the website, amaze.org. There's videos talking about pronouns, gender identity, you know, from K through, you know, 12th grade. You're going to get these different videos and, you know, language that is going to resonate with different age groups, as well as, you know, please come to our groups. You know, we can talk about it. Our groups are free. You don't need to be a patient to be a part of our groups. Once a month, we have groups for guardians as well. So if you're a guardian out there and you're like, hey, how do I support my kiddo, my teen? Come to our groups. We'll talk about it. As well as, you know, there's other awesome Chicago organizations, and I'll hand it off to Faith to talk about.
Okay. Yeah. So yeah, Brave Space Alliance is an organization ran by trans women of color, and it's a great place to check out. And then Broadway Youth Center through Howard Brown's really awesome, especially if you're experiencing like some home instability or anything like that. They have amazing resources there.
They also do therapy for folks that are uninsured as well. So, you know, you do a couple months of therapy with therapists who specialize in working with LGBTQ people.
Wow. Yeah. And then in terms of websites too, I'd also note that for like mental health and behavioral health things, the Trevor Project is awesome. A lot of resources.
Yeah, Glisten has a ton of resources as well. And then, you know, there's other organizations outside of Chicago that are doing really great virtual work. So Youth Services of Northbrook Glenwood, really awesome. They have a bunch of virtual services as well as in person. And so we love our working relationship with them.
Yeah.
Great. Yeah, thank you. I feel like all of that is just wonderful to kind of hear that, you know, there's a variety of resources out there that hopefully everyone can reach out to or really look into. Yeah, and hopefully it gets passed along. And I think I'm still waiting to see if there are any other folks who want to continue asking questions. But I guess for now, then I will ask, what services does Lurie Adolescent Medicine offer?
Yeah, we'll name a few. There's so many. Yeah. It's funny because it's like every person in our office is kind of like their own program. And so it's hard to remember sometimes. So some of the things that we offer in clinic are free STI and HIV rapid testing. We also provide naloxone training as well as sometimes distribution for folks. So that is, you know, what is the nickname for that? Like the
Narcan.
Narcan, yeah. So that is something that's really wonderful for folks, especially hot summer months, and people are going out and street festivals. And I know last year one of our nurses went to a local street festival and ended up saving 2 people with Narcan.
Oh, wow.
And so that's the overdose reversal. So if someone is using opioids. And so, I mean, outside of that, we have our TransMentor program that I run. So it's kind of, I think, like Big Brothers, Big Sisters. So we pair up a youth that identifies as trans, non-binary, gender expansive with an adult of a similar identity that's in or outside of the Chicagoland area. So they could be in person or virtual, as well as Faith and I run monthly groups for, we call it play, preteen, and teens. And so right now that's virtual. Once a month, people can come, they can chat, they can do an activity with us. This month we're gonna be making pride flags and talking about what pride means to us personally.
Nice.
So that's very exciting.
Yeah, and we also do, I think what's cool is that not all, you know, pediatric services recognize, you know, the difference of like the adolescents and the young adults. And so I think this is a really cool space, regardless of if you're LGBTQ, you can come here for primary care. And it's cool. I think they offer a lot of autonomy to the young people and independence. And then we have a gender development clinic. So folks who are exploring their gender or, you know, want to talk about transitioning medically, it's a great place.
Yeah. And then in addition to that, you know, there's more. I told you there's more. In addition to that, if you are someone that thinks that your workplace could really use a training, you know, to talk about gender and to talk about inclusivity, if you think your school, like your teachers need that, we're definitely here to reach out and provide those services. We have multiple different trainings that we do, as well as, once again, we are a third party that can go in and teach progressive, you know, inclusive, trans and queer inclusive sex ed K through 12.
Great. Awesome.
That's awesome that we have this resource in our city, and that we can use at all different levels, like as a patient, non-patient, parent, provider, everything, teacher. I love that.
Yeah, and as well as, you know, having the opportunity also to take advantage of like the virtual meetings. I feel like that's kind of the one good thing that came from COVID, is being able to, you know, use our laptops, our phones to get and virtually meet, especially with this past year and how it's been. So
yeah, especially as a teen where maybe you can't drive somewhere or get somewhere on your own.
I would say definitely like the silver lining of the pandemic is the fact that we've been able to reach so many teens in rural areas. Wow. And just have them, you know, join that 1 hour a month to get to talk to other trans teens, to know, hey, we exist and we're here. And so it's been really lovely in that regard.
Good. Yeah, that's awesome. Thank you. I mean, again, for sharing everything with us and being able to have this conversation. And yeah, sharing all the resources and having a connection between us and you guys. And yeah, and I think Michelle, if you also want to talk about the services at Heartland.
Sure, yeah. So we see like the whole family essentially, and we have multiple centers across kind of north side of Chicago. We have community health centers, I think in Lakeview, Wilson, Devon. I'm probably gonna forget a few, Rogers Park, Lincoln Square, where you can see like for adults, family med or pediatrics, and we also have OB-GYN. And then we're also in schools, so school-based health centers. So you don't have to leave school or like rely on a parent or transport to talk to someone about your health. You can just step out, and hopefully that's a safe space for teens too, or youth.
Yeah, definitely. And yeah, and also, you know, if we do have interested individuals wanting to make an appointment for Heartland, there's definitely our website or our main hotline number that you can call. Excuse me. And then of course you can be more than happy to make your appointment with male or female doctor, whoever you're more comfortable with. And again, we do have a variety of locations in the north side, so there's also that option to choose as well.
And I would just also say, like, we take everyone, regardless of your insurance. We're an FQHC. And we also, I think, compared to other FQHCs, really pride ourselves on our behavioral health program. So we have a strong connection with mental health providers, therapists, counselors, the opportunity to do like a warm handoff. So if you're here for a checkup, but you're feeling depressed, I can help you talk to someone that day, hopefully.
That's great. Thank you. So I was checking, I guess there are no other questions from the audience. But again, I would like to thank you, Logan and Faith and Michelle, for joining us and having this conversation. I think it was very amazing about all the topics we were able to tackle and talk on and share the resources that we both have to offer. And hopefully, again, there's someone out there that's gonna take advantage of this and hopefully help them out as well.
Awesome, it was great to be here.
Yeah, thank you so much.
Yeah. Of course.
Yeah, thank you. I learned a lot, and I'm looking forward to the list of resources too. And for people who are viewing, we'll share that too.
Yes, definitely. All right. Thank you, everyone.
Thank you.
Thank you.